Estamos aquí el día de hoy. Yo soy Axel Castellanos, gerente de marketing de GBI. Está conmigo también Teresa Rábago, que es la encargada del departamento de marketing en todo lo que tiene que ver con skincare y el negocio tradicional hacia los médicos. Y tenemos a Olivia Roumain, que es la cabeza de educación médica en Revision Skincare y que es quien nos dará la sesión del día de hoy. Al final de la sesión y después de las preguntas y respuestas, les compartiré una promoción especial que tenemos para ustedes para que puedan aprovechar esta emoción de conocer los productos Revision Skincare y puedan integrarlos a su práctica. Y pues bueno, sin más que agregar, los dejo con Olivia.
Thank you so much, Axel. And thank you for joining us again today for those that are attending again our webinars, and welcome to those that are new. I'm going to go ahead and just put the video aside so we have the full screen. I'm trying to see if there's a way to, I don't know how to get rid of that little piece right there. So if there's a way. So first, we're going to talk about the Nectifirm franchise. Revision Skincare has so many great products, and this particular franchise has a very unique positioning. This is what we like to call our industry first. And the reason for this is that these two products are able to hit home on technology that we brought into the marketplace before any other company. So we were the first to bring bioavailable peptides to the marketplace back in 2001. We were the first to bring in THD ascorbate, so vitamin C as a superior form of vitamin C, again, back in 2001. And if you can believe it or not, before the creation of Nectifirm and Nectifirm Advanced, there was no product on the market that was addressing the neck. We created a neck category by the formulation and production of Nectifirm. So this is a really big idea because now it's very common to see more neck products, but it all started here with Nectifirm. So I'm excited to share with you what it is, what it does, and why it's still considered such an amazing product that each and every one of you could have in your practice to offer patients the very best in skincare for the neck. Lastly, we have also in our Nectifirm Advanced a very unique technology which incorporates the microbiome. And when we talk about the microbiome, we're talking about an ingredient that is utilized with it to provide a brightening effect. So we actually use our ingredients for anti-aging purposes, and Nectifirm Advanced was the first product that we thought this innovation to leverage the microbiome. Before that, there wasn't a lot of products on the market that were doing that. So for those that have not learned a lot about Revision Skincare, we're always on the cutting edge of technology. We're always researching and developing new formulas, innovative ways to bring the very best in skincare for anti-aging. And these are just a couple of examples of how we've done that. Both of these products contain all of these great technologies. So just get excited to see and learn a little bit more of how these products can give amazing results to your patients. So first, let's talk about the signs of aging on the neck. None of us like to know what might happen to our neck over time, but the reality is that as all of us go through an aging process, we may come across some of these signs of aging. Some of the patients that you see may also be speaking to you about some of these signs of aging of concern. So typical signs would be rough, crepey skin, so dryness, flakiness, maybe even the wrinkles. Sometimes it's more of a crepey look. Perhaps it's right underneath the jawline, the accumulation of the fat or the adipose tissue. Sometimes here in the States, we say, the turkey neck or the excess chin. So this is an area of concern where a lot of patients want to look to procedures to get rid of, whether it's plastic surgery, whether it's through certain kind of Kybella or some kind of surgical procedure. In this case, there's actually products that can help complement that, but they may not even know it. So the accumulation here is a big sign of aging because there's areas of the skin that start to change. we also start to see retied lines. So what we're talking about is the necklace lines or the horizontal lines. We start to see vertical lines, platysma bands, and last but not least, also hyperpigmentation or unevenness in skin tone. And a lot of that is because our neck is exposed to the environment. Many patients don't put sunscreen consistently there. So it's exposed over time. And there's the ability for the neck and the face to also have discoloration, which over time can age the look of the neck. So these are just a few of the typical signs of aging that you may hear from patients or visually see that might lead you to think that we need to address the neck with a neck product, such as Nectifirm or Nectifirm Advanced. So let's go into a little further what's happening. At Revision Skincare, when we develop products, we study the area of the skin of where the product is going to go. So for example, for the eye, we will study the movement of the eye, the texture and the density of the skin around the eye, so that when we make a product for the eye, it makes sense of the formula to go to that area. The neck is no different. The neck actually is one of the places of the body that has the most movement. So not only is it the one that has the most flexibility, it has the most amount of rotation, which is part of the reason why these horizontal retied lines are repetitive. It's the repetitive movement that we utilize our necks, whether to lift our head, to look up. A lot of us now are starting to look down with our phones, right? Tech neck is what we hear it. We look down. So as we use this repetitive motion, we are contracting and we're starting to create these folds and a lot of these extra lines that start to break down, because the breakdown of the dermal matrix proteins over time also break down. We also start to see more discoloration. Again, we talked about how with the UV exposure and lack of protection around the neck, maybe even wearing fragrance, sometimes the alcohol or the oils within our fragrance can also attract or attribute to the discoloration of the skin. So all sorts of things are happening in the neck that might be different to, let's say, the face or the eye. When we look at the platysmal bands, this is also very important to keep in check. Sometimes as we age, let's say we're exercising to keep fit, our platysmal bands can become thicker, almost like cords. If you've ever seen someone that's lifting weights, these can get very strong. And so these strong muscles over time can also start to look very tense, which can age the neck, whether it's sagging skin or maybe thinning. We have some patients that have a very thin neck with saggy, crepey skin, and that looks very aged. So this is another area where they're going to need a product to help address the density and the moisturization around the neck area. And then lastly, we need to protect the skin, not only the neck, but also the décolleté. So just remember, when we're talking about the neck, it is addressing the neck, the contour of the jawline, but we're also protecting the décolleté area because this particular area of skin also has a very thinner tissue that needs density to be protected as well. Okay, so what happens in this breakdown? We have an area of the skin called the DEJ, and this particular breakdown happens over time. I'm going to show you an image that will help to visualize what happens. If you came to our DEJ webinar the previous time before, you may have seen this image, and you may be familiar with it before because, you know, when we're talking about skin, this is a very important piece of the skin that we try to focus on. So the dermal epidermal junction is the area of the skin that has very rare proteins. And when we're young, those rare proteins are fully abundant. The adhesion of the skin is very, very close and tight. Communication with the cells are very good. So there's a lot of exchange in nutrients, and the way the skin is holding on and adhering is nice, firm, and tight. Versus as we age, that breakdown of those proteins start to take place. free radical damage, the environment, pollution, all these things as we age are what's breaking down those proteins. And so you can see here as an example, if you're starting to become on an age skin, we see a more flattened DEJ versus a wavy DEJ. The wavy means young, healthy, intact. The flattened and slackened is what's showing a lack of density. Therefore, thinner skin, you start to see lines and wrinkles, and that's where the sagging and crepiness can also take place. So what you're going to see here when we talk about the products is that both Nectifirm and Nectifirm Advanced are addressing this particular area, plus an additional area to help with the contour of the neck. So this is a really, really key piece as to how we're addressing the aging process, unique to the density of the neck, which is different than the density of the eye and the face. So we have two signs of aging, or two solutions for formulas for different signs of aging. This is just a preview of what we're going to go into. So Nectifirm is the original. This is more for prevention to early signs of aging. Then we have Nectifirm Advanced, more for moderate to advanced signs of aging. I'm going to show you some pictures so you can see what the ideal patient is like, who you position the products for, and why. So we are going to go through both of these products more in depth. I just want you to see that there are two solutions and for different reasons. And those different reasons are attributed to the type of technology that are in each of these formulas. They are similar in ways, but they're also very different. So let's start with Nectifirm. So a little something about Nectifirm. Nectifirm actually was created in 2005. And again, there was no product on the market that was addressing the neck area until it was created. Something that's unique about Nectifirm is that it's been reformulated 5 times. And when I say reformulated, it's not that we started from scratch and redid the whole thing. It's that there was newer technology available, better ingredients available. And as they became available, we were able to incorporate it into a more updated formula. Why do I even mention this? One, it's because Revision Skincare owns its own manufacturing facility. So that gives us the ability to always be on the cutting edge of innovation. And when we know we have something better, we can incorporate it and introduce it to the marketplace right away. This is also important because at some point when we had formulated over and over and over, there was a moment where we needed to make another product, which was for Nectifirm Advanced. So we'll talk about why that even came to be. So just hold that thought in the back of your mind. Know that there was a need for more advanced neck treatments at the time this was first developed, and even over the years, up until 2017, when Nectifirm Advanced came around. So Nectifirm itself, this one, has been a huge, huge success because of the way that it is able to address several different areas of the skin. So quick benefits, it's going to firm, lift, it's going to correct any signs of aging around the neck area. So contouring of the jawline. It will also help to even out photo damage. I want you to think of more unevenness of skin tone. And lastly, if a patient has a skinny neck, already has a thin neck, this would be the product for them. Also, if a patient is new to protecting their neck with a product, so preventative care, this would be the product for them. So what is in it? This has 5 bioavailable peptides. Now, bioavailable peptides for us are super important because of the way that they will target very deeply into the skin and ignite those rare proteins in that DEJ, that wavy layer. We want to make sure that adhesion is nice and tight. So for maybe a preventative patient that already has a good DEJ, this will help to keep it nice and strong. For someone who is starting to see signs of aging, it's going to help that production start to increase in those rare proteins such as collagen 1, 4, 7, and 17. It of course helps with collagen 1 and 3. Those are abundant in the skin, but the rare ones are the 4, 7, and 17. And then we also have a couple other unique ingredients. So this has 5 bioavailable peptides and then 2 ingredients that target the adipose tissue. So this is a very unique difference to competitors out there. Most products on the market do not have an ingredient that targets and is clinically proven to address and slim down the jawline, the neck, the adipose tissue and jawline. So these 2 ingredients, the dihydromyristicin and the methylsolanyl carboxymethyl thiophylline alginate, it's a tongue twister. These 2 ingredients really help to reduce the adipose tissue. How does it do this? I want you to think of a fat cell, and the triglycerides and the glycerin that's in it are released. They are squeezed, they are released. So therefore the fat cell becomes shrunk and smaller. The contents of the fat are released naturally in the body where it's excreted, and it's not removing the fat cell itself. What it's also doing is helping to prevent further growth of the fat cells. So it's helping to keep it more suppressed so that it becomes firmer, tighter, and slimmer around the neck. So that's a really, really great difference between the technology in Nectifirm than most other neck products on the market. Last 2 things here with Nectifirm is that we have an abundance of great antioxidants, as well as ingredients to help with the skin's barrier. So just like we need to protect the skin moisturization, we need to do the same for the neck and the décolleté. And the reason for this is the tissue is much lighter. It's a lot thinner. And so with the environmental exposure, you have a harder time to keep the moisturization in. So we have great ingredients to hydrate, repair, and keep the hydration intact. Therefore, it's preventing the dryness and flakiness, and the skin will not look rough or crepey. It'll look nice and smooth. And then again, you're also protecting from the environment with the free radicals because of the antioxidant protection in there as well. So if you think of Nectifirm, again, really effective ingredients to protect and correct. And then you're going to see how this does this differently than the Nectifirm Advanced. So we're going to compare in just a little bit, but wanted to share with you some of the technology behind the product. We have a clinical study that we can share with you. So after this webinar, if you would like to see more of the details, both Nectifirm and Nectifirm Advanced have their own clinical. And these are just a few statistics to share with you some of the improvements. We saw great improvements in the areas of neck lift, the jawline, crepiness, overall photo damage, and even neck contour when the product was used twice daily over the course of 12 weeks. This is a before and after you're going to see in just a moment. But one of the questions you're going to get from patients is, how quickly can I start to see results? And the first time point that you can start to share is as early as 4 weeks. You can start to see a difference in the neck lift. Another time point is as early as 4 weeks, you're going to see a little bit of clarity in the unevenness in skin tone. And then over 12 weeks, all of those parameters will be an improvement. So if a patient is diligent and they're using this product twice daily, they will see an improvement in multiple areas of the skin. Crepiness, sagging, neck contour, etc. There's so many here that a patient can see great improvement if they already have those signs of aging from a preventative standpoint. And here is a patient that is, or subject who is not preventative. I want you to remember this product launched in 2005, and there was no other product until 2017. So this subject here is more advanced age. She's more mature. I don't have the exact age here, but I want to say somewhere between 50 and 60 years old. And as you can see, there is some redness. there is not a lot of sun damage, but the redness has even completely gone away. And you can see a nice tightening in the neck lift. So in that neck lift area, the skin looks smoother, tighter, more firm. Even around the neck jawline area is even tighter. And this is as early as 8 weeks. So again, if this patient here really wanted to see more advancement, we now have another formula to put them into. But this gives you a great idea to show how effective Nectifirm is on its own, as this is a great example of a patient who is technically more than just a preventative stage, and yet look how effective that this is able to correct the damage from the lifting and horizontal lines. Here is another photo of the improvement. So in this case, this patient or subject has deeper lines, the necklace lines, also some discoloration, not as severe as some damage, but there's discoloration, and you can see the texture has really improved. The lines are softer, and even just the overall health of the skin is overall much more enhanced. And this is over 12 weeks, twice daily use. And last one, this is just showing the ability to help to contour around the neck. This is a wonderful picture. This subject here, using it twice daily, you can see a very larger jowl, a larger drop in the contour of her neck. And yet you can see a tightening effect underneath after the 12 weeks. So even the neck area here, softer, more tight, not as red and irritated. The skin even looks more moisturized as well. This is a very impressive picture. So again, for patients wanting to prevent, correct, up to moderate signs of aging, this would be a great place to position the product. If a patient has a skinny neck already and there's no signs of adipose tissue, I would still put them into Nectifirm Original, because this product is going to take out excess adipose tissue, not more aggressive. Okay, so quick recap. For anyone that's young, that's looking to prevent, we've got that checked. For someone that's starting to see early signs of aging, what does that look like? So very fine lines, a little bit of the retied lines, horizontal lines, or some of the platysmal bands, slim neck, perhaps someone who's getting a neck procedure for the first time and they're looking to complement for at-home procedures. This would be a great one to provide. Again, look at the patient and understand where they're coming from. If this is a minor neck procedure, just to tweak a little bit of the concerns, this would be something that you could provide them a complementary product to partner with. And all skin types can use this. So this is a great product for all skin types. All right, best ways to use this: 2 pumps, palm of hands, moisturize, and then everything is from an upward stroke motion. So you can start in the décolleté area, working in small strokes all the way up towards the jawline, and then come across to the jaw, back and forth, all the way back almost towards the ears. And you would wrap it around the neck completely. In this picture, all you see is upwards, which is accurate. But remember, the neck has a 360 degree. So you would want to take the product and wrap it around the neck to protect all areas of it. You would do this twice daily as well. Okay, so we got from 2005 to 2017. And as you can imagine, we had a lot of offices, doctors, physicians, that were asking for a more advanced formula. And the reason they were asking is because they started seeing patients with severe sun damage. And with sun damage, as being one of the biggest contributors to aging, their skin was looking even more sagging. They had patients with more adipose tissue. So I want you to think of like severe aging. And yet our Nectifirm, as the technology was amazing, needed to be enhanced just one more time to get to that point. So that's the moment where we said, I think it's time to make a separate product to address those advanced skin concerns. And that's why we have the two, because not everybody is in the advanced aging process. We do have that preventative care. And that's another reason why it's so important to keep both of these products in mind, because not everyone is in the same stage. So here comes Nectifirm Advanced. And this particular product truly is an innovative first, because thinking of that sun damaged skin, this is where we leverage the microbiome for the first time for anti-aging purposes. So we'll talk about that ingredient and how that works. So why this is unique. First, it's that we target the microbiome and we leverage it to create a more brightening effect. But what's really different is that this has even more technology, more ingredients that are surrounding the firming, the lifting, the sagging, more so than Nectifirm. So everything Nectifirm does, think of this as doing it more. It's like taking a, let's say you took your Mercedes-Benz and then you got a Ferrari. So you took a great vehicle and you got like the very best in motorsports racing, right? So these are both amazing products, but it's like it went turbo. You just kicked it up a notch. So this truly is a very active product, and it really needs to be dedicated to someone with the more advanced aging. So we're going to show you pictures to really identify that patient. Now, I'm going to show you some of the ingredients so you understand that level of oomph. This has instead of 5 bioavailable peptides in Nectifirm, this has 8. All of these peptides, again, 8, this has the most amount of bioavailable peptides in our entire line of revision skincare. So I want you to imagine we are pulling all stops to lift, to firm, to increase the density in the neck in order to help increase the ability to revitalize what has really been damaged over time. So this is a very, very active product when it comes to firming and lifting those proteins. This also has 4 ingredients for the adipose tissue for underneath the jawline instead of 2. So if a patient has excessive fat underneath the jawline, this would be the product that will help target it like that. So be careful. If a patient has a very skinny neck and they do not want to lose more of the adipose tissue, this would be too active for them. You would want to put them in Nectifirm because it's only going to help whatever's excess. This is a very, very active product, so that's something to keep in mind. In this product as well, it has diglucosyl gallic acid. So diglucosyl gallic acid is the ingredient that we use to leverage with the microbiome. Here's how. Gallic acid as an ingredient, when used by itself, is very unstable. But when we add the diglucosyl group to it, we connect it, it stabilizes the product or the ingredient. And then when it's touching the skin, once it connects with the microbiome, the enzymes within the microbiome cleave or cut the diglucosyl group, allowing gallic acid to deliver purely to the skin. This combined with the THC ascorbate, or vitamin C, the combination together helps to even brighten the skin even more, which is perfect for someone with advanced photoaging skin. So if there are patients that have laid out in the sun or have extreme discoloration, this would be an amazing product for them because of the additional benefits of the diglucosyl gallic acid. The other part to this that is not in Nectifirm is that we have a smart antioxidant system, and that's what you see here with this lingonberry extract. So what this means is as we age, it becomes harder for our own skin to improve itself and fend for itself. I want you to think of when we get sick, our immune system is down, right? Our immune system is compromised. So we would want to take better care of ourselves with having our vitamins and our sleep and our water. This product, by having the lingonberry extract in it, increases, it stimulates our own skin's natural antioxidant system. So it starts to combat the free radical damage from the inside out. Why is that important in this product? Well, because the neck is very delicate, almost like tissue. And because of an aged skin, when the skin is breaking down and there's less proteins in it, it needs every bit of protection from antioxidants from the free radical damage in order to prevent further breakdown. So imagine here we're helping to lift and firm the skin while we're slowing down the breakdown of those free radical damage. And then we do that by having the support of these great antioxidants in the system. So it's a really cool, innovative product. This is an amazing product, but it's really meant to be for someone who is in more of that age, that more severe signs of aging. So sun damaged skin, lots of crepiness, excess adipose tissue. That is the patient for Nectifirm Advanced. I want to show you this particular slide because this comes from our clinical done for Nectifirm Advanced. And what you're seeing here is an ultrasound image. On the left, you see the baseline. And this is actually taken from the lower jawline area where the subject started with a 53% density. And in this density, you can see that there's these black sort of holes. This is the extracellular matrix, and these black holes represent a lack of proteins. So the lack of proteins mean a weakened DEJ. Now, over the 12 weeks, when the subject was directed to use Nectifirm Advanced twice daily, what you can see here is that there's less of the black holes. There's still some, but there's less. And you can see there's more filling of the extracellular matrix with these proteins. The proteins are in these bright color dots. So the blues, the pinks, the yellow. All of this is the proteins that are stimulated. They're starting to increase. And this is helping to thicken the skin. We went from 53 at baseline, and after 12 weeks, the skin became at 70. So this is just showing, again, what Nectifirm can do with those peptides, those 8 peptides, to really heighten the skin, thicken it, which makes it firmer, denser, and even more firm to make it smoother all the way around. The other thing this does is that it evens out the subcutaneous level because of the way the adipose targeting blend is removing the excess adipose tissue. So the skin doesn't look as loose. In fact, it becomes tighter as well. So that's another thing to look forward to. And again, great clinicals all the way around, clarity in the radiance, firmness in the neck, even the texture and tone is improved all the way through. So if you would like a copy of this clinical to read more in depth, I have provided that to our team with GVI so they can provide that to you as well. These are just a couple of the statistics. There's a lot more. These are just highlights for you to get excited about since there's really great material on this. Here's a before and after to show you again. Now this patient or the subject has a lot of discoloration, more so in the sun damage. Remember, sun damage makes the skin more thick and more dense and rough. It even makes the lines deeper and much harder to repair. So what you're seeing here is an improvement, and yet there's still room for improvement beyond, because even though there is an improvement, the amount of damage that takes place from the sun also takes time to repair. So here you can see after 12 weeks, there's already a softening, less of a discoloration, and even a smaller amount of the jawline in through here. This subject would continue to use this in order to get even smoother and smoother and smoother on the skin. Here's another example where you can see a lift. So in here, the jawline is more tight in through this area. And especially here where the deeper lines are smoothing out in the neck. So again, very important to go all the way around to the back. And even in the front, the crepiness that is usually accumulated into the base of the neck area, also very difficult to lift and to repair. So just a little recap, this is going to be for the more extreme, deeper lines, more sagging, lots of excess adipose tissue, sun damage. This would definitely be for someone who has maybe a neck lift. I would certainly put this product onto that patient to make sure they're protecting their investment. Perhaps someone who is getting Kybella, if they are also seeing a lot of excess adipose tissue, this would be a perfect product for them as well. And again, this is just an example of, age range. So I'm going to use myself as an example. On my neck, I would say I don't have a ton of sun damage, but there is some discoloration. And as you can see in here, there is some lines and wrinkles on it. So I would be a primary patient where I'm still in prevention and some correction mode. I would still be a candidate to use Nectifirm. However, if I started to see more discoloration, more adipose tissue, I could start to then sway over into Nectifirm Advanced. So you are going to have those patients in that moderate category that could go either way. And this would be a conversation as to what their main concern is, plus what you observe based on the aging of the skin to then determine which particular product would be best to suit their concern. And same directions that we would use Nectifirm, we're going to do that with Nectifirm Advanced. 2 pumps. I would actually say 4 if you were going to use it on the décolleté. This particular product is a little thinner in texture, so you do need a little bit more to apply. So I'd say 2 to 4 pumps, and then an upward motion all the way through to the jawline and in the back of the neck. One difference you'll feel in Nectifirm Advanced is a tightening effect, almost immediate. There is a red algae in the product that gives you this kind of tightening effect. So while it has a benefit as an antioxidant, that's the tightening that a patient may say, I feel it's feeling tight. They're not imagining it. It's actually an ingredient in the product. So as they place it, or if you try it, you might find that difference between the two. Okay, so how would you bring this up with patients? This can be very important because nobody wants to sound like they're selling to a patient, and it's important that the patient is bringing these subjects up to you as a medical expert. However, sometimes patients don't even know that there are products to address the neck. Sometimes patients know there are products to address the neck, but they don't know that there's ones for the jawline. So everything's about education and having a conversation with patients while they're already in your office, sharing with you some of their concerns. So I think first and foremost is really having a conversation in a consultation when they're bringing up issues about aging. So if a patient says, I'm really concerned with the lines and wrinkles on my eye or on my face, address those needs first, of course, and recommend whatever is most suitable for the patient, whether product or procedures or both. And before moving on, I think it's important to just share, we've addressed the areas that are your main concerns for your eye or your face. We have other areas that we can also address that. Do you have any concerns for lines or wrinkles around the neck, whether to prevent or correct? And that simple question of just asking them, do you have any concern to prevent or correct in the neck area? Some may say no. Some may say, what do you mean? Some might say yes. Whatever the answer is, even if the answer is no, it's a nice opportunity to share when you're ready or if you need, we have products that will address not only the neck, but also contour the jawline. And this will help them start to think and remember about these products. But more importantly, they'll start to ask, tell me more. Sometimes they don't even know what it is that these products have. And oftentimes, 8 out of 10 times, they do want to touch and feel the product because they don't even know about it. So wanted to share this with you because it's about educating the patient and everything that we need to do to protect the integrity of the anti-aging process in our face. We really need to do it for our neck, for our hands, even our body. Everything needs to be addressed with the right products. And so this is a good opportunity to share that with your patients. This is also a quick overview. I just wanted to highlight and this is by no means something to call other competitors out. I only want to share this because there are so many different neck treatments on the market. And so I only want to highlight the differences between us. If you see here in the gray, there's two major areas where we stand out. And those areas are the bioavailable peptides. So when it comes to firming, these firming areas are, we have more peptides to firm and lift more so than any other product on the market. So 5 and 8, we still outperform. And we also have it in reducing adipose tissue. There's no other product on the market today that addresses the neck that is clinically proven to still also contour the jawline. So across the board, there's many great treatments out there, but none do every category as well or better than Nectifirm and Nectifirm Advanced. So I just want to put that out there for you. The truth really is we set the category, we've made the category, and we continue to add to these products as new advancements and technologies are available, because we have the ability with our manufacturing facility and our connection to the suppliers. So biggest point of difference is because these products are loaded, we are going to be addressing all levels of the skin. So 1, your patients will have a result. So that's excellent. They're going to be satisfied. 2, they will get to see a restored density. So a younger outcome, a younger looking skin. Another point of difference is we're addressing the microbiome, which is actually an important piece of the skin to help balance it and brighten it. And both products are pH neutral, which means all skin types can use it. So that means all patients are a good candidate for either one of the products, depending on their skin concern. Okay, so positioning it, we talked about the consultation. We talked about educating it to the patient as well, as they may not know that products for the face are not for the neck. That's huge. The one other piece I want to talk about is the pre and post treatments. So if you start to carry different neck procedures, start to think about the protocol, not just what you use after the procedure, think about before the procedure. So at Revision Skincare, we really focus on what we call healthy, beautiful skin. And that starts with not only what's in the products, but it's also about the pre-care. When the skin is in better shape before a service or a procedure, the skin is able to mend or heal even better. Therefore, the outcomes can be even more improved. So it's just as important for us to have products before a procedure, just as much as it's to use after. And Nectifirm and Nectifirm Advanced could become those products that you would place a patient on before a treatment. Then they would have their procedure, wait till the skin is reepithelialized in case there's any broken skin, and then they can continue utilizing the product at home in between the next procedure session. So if they have a series, they would use it in between the next procedure. So this is a really key place to position it. 1, it will have better outcomes. And 2, it's strengthening the overall result between the products and synergy of at-home care and in-office use. So these are a couple products that you can also pair well with, and then some of the other treatments in the office. So if you currently sell any of the DEJ products, and let's say a patient is loving that, they're using the DEJ products, this could be another great conversation to show and tell them, for example, you're already using our DEJ face cream and our night cream. Did you know that we have a version of those products for the neck? If they said no, you could show them. We have Nectifirm and Nectifirm Advanced. These products are like the DEJ products, but of the neck. And it's true. They were actually made inspired by the same DEJ technology, but for the neck specifically. Another item that we have is the Revox 7. This helps to boost the extra peptide. So let's say they're using Nectifirm or Nectifirm Advanced and they want something to soften the lines. Revox 7 could be a complementary product to put before. It's not a must, but it's a great way to additionally use a product they may already have. So that can complement. And then lastly, we have C+ correcting complex 30%. This product contains the most amount of THC ascorbate, the leading form of vitamin C. So if there is even more sun damage and we really want to even out the skin tone, a patient could put this product on first and then apply either of the Nectifirm products so that they would get the extra dosage of the vitamin C. Even though both products have THC ascorbate, this has 30%, so you would just be adding more, which the skin does accept and use more of the vitamin C. So too much is not a bad thing with vitamin C. It's actually a good thing. So these are a couple products you could connect with. And then on the procedure side, several different options. Microneedling, we know there's some RF microneedling for tightening, even on the neck. This could be paired. Lasers, Kybella, cool sculpting. These are all different forms of great procedures that would be an amazing, amazing pairing with our Nectifirm products. I actually just did a microneedling actually on my neck about 3 weeks ago. It was my first time doing any kind of procedure on the neck. I really wanted to see the tightening effect of just the procedure. And I use Nectifirm currently, and it was amazing. So I waited until the skin was healed. I waited 24 hours, and then I applied Nectifirm as I normally do. I think within the first 24 hours, once the skin was not as red and healed, the very next morning or very next night when I started using it, it was as though there was no microneedling on the skin, but the skin definitely looked more firm and taut and toned. So it was a great experience. All right. So again, if you're not currently using Nectifirm or Nectifirm Advanced in the practice, you're definitely missing out. I would 100% recommend that this is a product that you really consider to bring and really look at when you're looking at the procedures. It's really important that you consider both options. They do have different price points. So again, different needs, different solutions for different patients. And this also gives your patients the ability to know that not one size fits all with the neck concerns. They actually do appreciate that there's a way for them to graduate as their aging process changes. So having the two options also gives you credibility to know which one is the right one for the patient as well. So with that, I'm going to turn it over to Axel for some of the information you have on the promotion.
Great. But first, we do have a couple of questions I don't have here. So the first question is, how does the modeling effect works? Let me try to elaborate though from the Spanish question. Does it thins the skin or the neck, or does it just moves around the adipose tissue?
So how does the when you said modeling, are you talking about how does it move the adipose tissue?
Yes.
So what it does is in the formula, so both formulas, Nectifirm has the 2 ingredients, Nectifirm Advanced has the 4. As it's applied, they stimulate the release of the triglycerides. So it's like the lipolysis process of the adipocyte. So that release of the triglycerides, it starts to shrink it down. The biggest difference is the Nectifirm Advanced has more ingredients in it. So it's actually releasing it quicker and more. I want you to think of, I don't know, in Mexico, do you guys have like this a Spanx or like a como faja, like the
Yes.
like spinning? I want you to think of Nectifirm as como una faja, like really tightening. And I want you to think of Nectifirm Advanced like a corset, much tighter.
Okay.
Both shrink, but one's much tighter. That's the biggest difference. The release of it, what happens is the adipocyte, the triglycerides, the free fatty acid is released, and then naturally it's excreted as you would, sweat or use a restroom. It's excreted naturally through the skin. So we're not removing the adipocyte. It's just the excess fatty tissue inside the cell.
Perfect. Another question is, how low could you go on the décolleté? Yes.
Good question. And I'm glad that someone's asking this question because I would not have remembered to say this, but this is important. So we know that sometimes women would go in for surgeries for bust enhancement, right? So bust enhancement means, adding the fat into the chest area. So I would say anywhere where the pectoral muscles start to form is the cutoff point of where you would not want to place Nectifirm because of the way the adipose targeting blend works. So if let's say here on top of my décolleté, I'm doing it right before the chest muscles, from that part all the way. I say from bust line to jawline is really the area. Anything further down, you're starting to get into natural fatty pads into the skin, and that could have the effect of reducing the fat in those areas, which may not be favorable if someone's trying to keep that in those areas.
Great. And another question is, does Nectifirm offer some brightening effect, or it just reduces the photo damage?
Both. So Nectifirm has THC ascorbate, which does two things. It protects. It also helps to firm a little bit because of the vitamin C, and it brightens. And so when I say brightens, it does even out skin tone. You may have remembered some of the photos that has the clarity. So think clarity and radiance. The Nectifirm Advanced has those two ingredients, which really help to even out the skin tone further. So more photo damage.
Perfect. And we have one last question. Does it has to be combined with an additional moisturizer, or does it have a moisturizing effect on its own?
Great question. They already have moisturization properties already built in. So this is a treatment, moisturizer, serum, all of it all in one. All they have to do is apply it, and that's it. I would say if you add anything to the neck, would be a sunscreen during the day. That's it.